this is Shiny and welcome back to another episode of Thoughtful Leaders Thoughts on Education presented by College Dunia. Today we have with us Dr. Ramita Sood ma'am, Professor and Head of Oral and Maxillofacial Surgery, AMC Dental College. Welcome to our show, ma'am.
Thank you so much.
So, ma'am, to start this interview, first I would like to know about your department and your roles and responsibilities.
So basically, I head the Oral and Maxillofacial Surgery department at AMC Dental College and Hospital. I have been heading this department since the last 10 to 12 years. We have the basic role and responsibility of managing and treating patients with oral surgical diseases and problems here. At the same time, we are into a lot of interventional procedures. We deal with pathologies, cysts, tumors, fractures, and impacted teeth, and a host of other facial deformities. Basically, we are men at work for the face.
Right, ma'am. So, what are the USPs or I can say the valuable insights of your program in your department you are offering?
So, because we are a postgraduate training department also, since we are a part of the institute, so we offer a lot of varied educational programs along with the routine activities that we are considering and that we are doing here. Includes a lot of research work at the same time. I also head the research department here and the member secretary of the institutional ethical committee, and so being a part of that, it is also our responsibility to give an impetus to research programs. Within that impetus only, we have been very happy that we are able to do a lot of publications through our department, and we also hold a lot of interdepartmental activities and surgeries with the other institutes associated and affiliated with AMC Met.
Right, ma'am. So, moving to my next question. How does the program in your department ensure that students are being prepared for the future?
So we have a lot of success stories to share of the students that have cleared and who have trained with us, and those who have done their residency program from here. A few of them have actually been successful in oncology side, and they have also trained for fellowship for head and neck oncology. 2 or 3 of other residents that we have trained up till now have been very successful in aesthetic facial surgery. So it is always our endeavor that we give them a basic platform, and within this platform they are allowed to function, they are allowed to experiment, and they are allowed to delve further into their favorite field of research as well as their favorite surgery, and then they go ahead from there.
Okay, ma'am. So, how do you train yourself and faculties to deliver these programs to the students?
Because again, like I said, that since we are both clinically and academically oriented, so as per guidelines and as per our own interest, we are attending a lot of conferences, workshops, and many such mentorship programs. Within these programs, we are trained or we get ourselves trained for further better and more interesting surgeries, those which we may not have done before but we would like to do further. So we go for such training programs nationally, sometimes internationally also. On the academic side and research side, we regularly attend good clinical practices programs, GCP workshops, which are also mandatory by the government as well as by ICMR, and so it gives us an insight. We also do a lot of teachers training programs, and in these programs we are trained how to mentor as well as how to motivate students for further academic research.
Okay. So, what are the type of projects or cases students are working on through your department's offering?
Yes, so a lot of projects are in the pipeline, includes many different types of surgical aspects of implantology which they are trying to know further and further. We are also trying to use more and more new types of materials as well as new medicines for management of a lot of chronic disorders, like for prolotherapy for temporomandibular joint, as well as we are also into treating using gas cryotherapy for treatment of benign lesions. So these kind of newer inputs help us, and they also give us a good idea about whether it is going to be useful to us in the future or it should not be pursued. So these are some of the programs.
Right, ma'am. So, the benefit and career options after pursuing this course.
Oh, there are a wide number of options. Many of our students will probably go abroad and they will pursue their masters in public health. Many of them going for different kinds of biological training programs, biology training programs. They can go into genetics. Many of them do health management courses. So many of them diversify into law, since nowadays ethics and law have become an integral part of medicine and surgery, as well as many of them will take up doing further specialized surgical courses in various countries. So there are many career options that can be actually pursued after taking training from our institute.
Right, ma'am. So, ma'am, we have come to an end of this interview. So, I would like to end this interview with this question: that any suggestion you would advise to current youth and aspiring students for dental as well as in general?
So, like a lot of great leaders are also saying that there is whatever you try and do, it should be with lot of sincerity and commitment. Perseverance is the key. Do not lose out on any opportunity. Failures will always come your way. Does not mean that you are not going to make an effort. It is the effort that matters. It is the means that matter. And once the means are very sincere, the end is bound to be there.
Right, ma'am. Thank you so much for your interview. Thank you from College Dunia, ma'am.
Thank you so much. Thank you, College Dunia, for giving me this opportunity.
Thank you.